Respiration is the physiological process by which the body exchanges gases, oxygen and carbon dioxide, between the atmosphere, the bloodstream, and ultimately the cells. This process is essential for maintaining cellular metabolism and overall homeostasis. The mechanics of respiration involve the inhalation of oxygen-rich air into the lungs and the exhalation of carbon dioxide-rich air as a byproduct of metabolic activity in cells. These exchanges occur primarily in the alveoli, the microscopic air sacs within the lungs, which are surrounded by a dense network of capillaries to facilitate efficient gas diffusion. The respiratory rate, which measures how often this gas exchange occurs per minute, is influenced by several factors and varies with age. For adults, the normal respiratory rate ranges between 12 to 20 breaths per minute. In children and infants, this rate is naturally higher due to their increased metabolic demands and smaller lung capacities. Nursing considerations. Respiratory rate is sensitive to a variety of physiological and pathological factors, making it an important vital sign. Many conditions or influences that affect pulse rate also impact respiration because of the interconnected nature of the cardiovascular and respiratory systems. 1. Carbon dioxide and oxygen levels. An elevated carbon dioxide level, hypercapnia, or decreased oxygen level, hypoxia in the bloodstream, stimulates chemoreceptors in the brainstem and carotid bodies. This triggers an increase in the respiratory rate to expel excess carbon dioxide and intake more oxygen. For example, during strenuous exercise, carbon dioxide production increases due to heightened cellular metabolism, causing a compensatory rise in breathing rate. 2. Neurological influences. Head injuries or elevated intracranial pressure can affect the brain's respiratory center, located in the medulla oblongata. Such conditions may result in irregular or depressed breathing patterns, such as shallow respirations or bradypnea, slowed breathing. Understanding this is critical in neurocritical care settings where respiratory changes might signal worsening intracranial dynamics. 3. Pharmacological effects. Opioid analgesics, commonly used for pain management, act on the central nervous system and can suppress the respiratory drive. This is particularly important in post-operative or palliative care, where close monitoring of respiration is necessary to avoid life-threatening respiratory depression. 4. Other influencing factors. External variables like exercise, pain, anxiety, smoking, and body positioning significantly affect respiration. For instance, exercise increases metabolic demands and requires higher oxygen intake. Anxiety or pain often leads to hyperventilation as part of the body's stress response. Body position, lying flat, supine, can impair diaphragmatic movement and lung expansion, leading to reduced respiratory efficiency. Assessing respiratory rate. Accurate assessment of respiratory rate is fundamental in evaluating a patient's respiratory status. The procedure is designed to minimize awareness of the patient to ensure natural breathing patterns. 1. Timing the measurement. Respirations are typically counted immediately after measuring the radial pulse to avoid alerting the patient, which might consciously or subconsciously alter their breathing pattern. The nurse should either continue holding the patient's wrist or place a hand on their chest to feel for respiratory movement. 2. Counting respirations. Each respiration comprises one inspiration, inhalation, and one expiration, exhalation. In healthy individuals with regular respiratory patterns, the rate can be counted for 30 seconds and doubled to estimate a full minute. However, in cases of irregular breathing, illness, or respiratory distress, counting for the entire minute ensures greater accuracy. Evaluating depth, pattern, and sounds. Observing the depth of breathing, shallow or deep, its regularity, and any abnormal sounds, e.g., wheezing, crackles, or stridor, provides additional diagnostic clues. For example, shallow breathing might indicate pain, fatigue, or central depression of the respiratory center. Irregular patterns, like Cheyne-Stokes respirations, could point to severe neurological or cardiac conditions. Audible sounds, like wheezing, suggest airway constriction, often seen in asthma or chronic obstructive pulmonary disease, COPD. Summary. Monitoring respiration provides critical insights into a patient's overall health. The interplay between oxygen demand, carbon dioxide clearance, and external influences highlights the importance of understanding and accurately assessing this vital sign. Nurses play a pivotal role in recognizing deviations from normal respiratory patterns and initiating timely interventions to address underlying issues.